This conference will now be recorded.
Well, good morning, good afternoon, good evening to everyone who's on our webinar today. Welcome to our Organizational Excellence Specialist webinar on Let's Examine Healthcare Excellence and the Data. My name is Dale Weeks. I'm a specialist for organizational excellence with OES, and I have been in and around quality and performance excellence for probably 20, 30 or more years in both healthcare, doing some involved in education, public sector, not-for-profits, and just with an overall focus on accelerating the use of our organizational excellence framework across the world. Our speaker today is Dawn Ringrose, who's the principal of our OES organization. She formed it 10, 15 years ago. I've worked with Dawn off and on for probably 10 or more years. In the last 3-4 years, specifically related to OES, and then prior to that with the Global Benchmarking Organization. She's a certified management consultant in Canada and across the world, and is here to bring us the data on healthcare excellence in the world and what our index shows. So we'll proceed and take it away, Dawn.
Okay, thank you very much, Dale. I'm really looking forward to diving into this data that we've been collecting on the healthcare sector. We started this study back in 2015. Originally, it was launched by the Organizational Excellence Technical Committee of the Quality Management Division at ASQ. And after we had been, doing the study for a couple of years, that was kind of coming to a close with the project that we had charted out there. And I decided to keep it going because I thought to myself, this is so interesting to take a look at what's going on in organizations around the world by size, industry sector, and region, and in some cases, country. We've got enough data to kind of provide a snapshot of a country. And so today, what we're going to do is dive into this data and see what it's telling us. So that's kind of setting the context of what we're going to do today. We'll be going through the data and information, taking a look at the principles and the aggregate ratings, some of the comments that we've received, and getting a sense with regards to those principles, how respondents are feeling about the culture and the degree to which it's committed to excellence in their organizations. And then also diving into those respondents that completed the full assessment, which includes the principles, but also includes all the practices across the key management areas. And that's where we look at, where the rubber hits the road, the extent to which they've implemented these practices. Are they using a good approach? Are they getting results? And so we're looking at it in, with a fine-tooth comb, so to speak. So we'll take a look at that data and information as well. Then Dale is going to share a benchmarking example so we can really appreciate what a high-performing organization looks like in the health sector. And then we'll talk just very briefly about the way forward, for those organizations that wanted to continue to up their game. What's an easy way to go ahead and do that? So I'll just start off with a quote here by Hippocrates about medicine. And it's interesting, wherever the art of medicine is loved, there's also a love of humanity. And we were talking about this just prior to the webinar starting, that, healthcare is one of those sectors that's so important to any country in the world because it has such an impact on the quality of life that residents have if healthcare is managed well and the services are available to them. So I might just turn it over to the audience and just answer in the chat, how are your healthcare institutions going? What's going on? And if you were to use just a subjective rating of its high performance, we're doing excellent, right through to medium or low ratings, gee, we're not doing too well. What's your perspective? And just would ask you to place your ratings in the chat. And if you've got a comment that you want to make, of course, put your hand up and we'll let you make a comment as well. So please take a minute to do that. And Dale, you just let us know if there's any comments in the chat, any hands up. I know we were talking about how our healthcare institutions are doing prior to the webinar, and boy, there's some things that are going well, but there's some challenges in both our countries, Canada and the United States.
Well, we've got 2 submissions so far. One that says on a scale of 1 to 10, their healthcare institutions are a 6. Another says on a scale of 1 to 5, most are in the 2 to 3 category, which says very similar. You use what Don mentioned earlier before we got on in an academic setting, 6 out of 7. You're a D, not necessarily an A or a B. So there's plenty of room for improvement.
Right. Yeah. Kind of medium type ratings, right? And average, and so when we think about how our healthcare institutions are doing, I want to get a sense too, what sources do people use? Like, are they looking at data? Are they looking at personal experiences? How do you get a feel for those healthcare institutions? Because if you're in the business of healthcare, you're going to be closer to certain sources of data. If you're more a resident experiencing the healthcare system, your experiences are more anecdotal, right? So I'm just curious as to what sources of information people are using. I know at OES that we have a tendency to look at the Social Progress Index and the OECD as they review what's going on in industry sectors and provide feedback. And then we have this index that we'll be talking about shortly. That's quite revealing as well. But are there some other sources that people are using? Any feedback there?
Well, it's both. First is starting at a personal assessment. As you said, Don, everybody can experience or will experience it one way or another, either where they sit or if they happen to travel somewhere else for healthcare services. So it starts with a personal assessment as a patient. In my case, it's, whether it's my dental provider, whether it's my medical provider, you go day to day or you go month to month and you have an annual checkup or whatever you might be checking, and then you assess how well that individual patient experience was there. And then beyond that, for those of us that are involved from a organizational standpoint, there is local and national sources, the ones that you mentioned regarding how well-being is on the OECD and the other international sources. But I think it all starts at the personal level. How do you feel? Here in the United States, where I sit, a common assessment is how much time does your physician, your personal physician, spend with you? If you go for an annual visit, do they spend 10, 15 minutes? Do they really get to know your personal history, or is it much more hit and miss? Here in the United States, I've seen data that said it used to be 10, 15 minutes, perhaps. They used to go way back to history, and it's the doctor shows up at your house. Well, we don't have house calls, but now the data shows maybe just in general, the doctor will spend 3 to 5 minutes with you if you're going for an annual checkup or if you go twice a year. 3 to 5 minutes. Is that enough to give you the comfort you need that they're really aware of it? So I think it starts at that personal level and then goes beyond that to be able to assess hospital by hospital in your locality or on a national basis. Just my thoughts.
Okay, thank you. And I find personally here in Canada, I find it really depends on who you deal with, because you can have a general practitioner that's part of the healthcare system, a part of our national system, but you can go outside of the system to visit with a naturopath or or other practitioners, and it's very different sources of treatment that you pay for. We pay for our healthcare system with our tax dollars, but when you go outside of the healthcare system to look for other practitioners to assist you with more traditional methods, and you pay additionally out of pocket, it's quite a different experience. So I've noted that over the years here myself. But let's take a look
Yeah.
at the global index, because this is where we're taking a look at how people in the healthcare sector are self-assessing their organizations on the degree to which they have a culture committed to excellence and the degree to which they've deployed all the best management practices that are part of an excellence model. And it allows them to see how they're doing and stack up against a high performing organization, but how they also compare to others. And we're using the organizational excellence framework to do that. And for those that don't know about it, this was developed back in 2010. And what it does, it integrates the leading excellence models, EFQM, Baldrige, the Canadian and the Australian models. And so we've got all these best management practices and principles in one place, the definitions of them, but it's also added implementation guidelines for the user, because that's something that had been kind of neglected in the excellence literature. So we're using this as a pretty comprehensive tool in the asking these organizations to do their self-assessment. And here's a look at the 9 principles that are part of the organizational excellence framework. And I think they're pretty self-explanatory. The only one that some people ask about is alignment, and that's where we're looking at alignment, a clear line of sight from the strategic plan to the business plan to the work processes to the employee performance plan, the way performance is measured and that sort of thing, so that everything is aligned and runs efficiently and effectively. And when the respondents are assessing their organization on these principles, they use a subjective scale. It's kind of a gut feel that they have, through observation or experience on this 5-point scale, low, kind of medium, high scale, with high being, more high performing. We're best in class sort of thing. So this is the subjective scale that is used. And for those that have responded to just the teaser, as we call it, the teaser assessment, just that assessment on the 9 principles, we see that we've really got quite a number of respondents for this particular assessment. And we've got a good cross section of leaders, managers, and staff, and interesting kind of breakdown of healthcare organizations around the world, because we see most of them are in the business category, and then others in the government and nonprofit area. And we have mostly large size organizations that are responding here on this particular assessment. And we break down size by number of employees, where micro has 1 to 25, small have 26 to 100, medium have 101 to 999, and large is 1,000 plus. So that just gives you a sense of the kinds of respondents that we've had on this particular assessment. And I'll also give you a look at, where they've been located. And so you can see we've got a pretty good cross section of respondents from around the world, but a little light in the sub-Saharan Africa area, but 127 in total. So that's giving us a good feel for what's going on in the sector. And the results tell us that their most highly rated principle is that focus they have on the customer, which is interesting, but also that commitment that they have to society and making their society a better place for the residents. And that's not surprising when you think about the healthcare sector. But rated just a little bit lower is that prevention-based process management. And that's where you're taking a look at your work processes and trying to be preventative if errors occur or failures occur, that we want to make adjustments to your work processes so you prevent that from happening again. So that's an area that could use a little bit more work. Now, the principles is also part of the full assessment. So here we're going to take a look at the same scores on those 9 principles, but we're also going to take a look at what's going on in the 9 key management areas. And when you look at all the practices, there's 102 of them. So it's going to be a much deeper dive. And for this particular assessment, you can see there's a bit of a difference here. We've got mostly management responding, good cross-section across type of organization in terms of business, government, and nonprofit. And again, a little bit more weighted towards the larger size organizations or even medium size. So these are the types of people that have taken the time to respond to the full assessment. And it takes a while to do this. It's about 30 minutes to provide your ratings and open-ended comments. But boy, does it ever give us a rich source of information about what's really going on in these organizations. So it's very valuable for everybody at the end of the day. And here's the level of participation that we've had from particular countries. And so we've had some pretty good responses from, United States and Turkey and Canada, and it's good to see who's been responding to this. We see great representation around the world and 43 respondents. So we've got to be careful with the data here and drawing any conclusions. But again, it just gives us a sense of how the sector is doing. And we can see that the ratings on the principles are relatively similar in a lot of respects, but they remain high on the focus on the customer. And also we see leadership and involvement is showing a bit higher rating as compared to the teaser assessment. And we see again, societal commitment is rated quite well. But on the low side is now database decision making, which is very interesting. And if you take a look at the global index overall, we'll see that leadership involvement and focus on the customer are more highly rated, and prevention-based process management and database decision making are lower rated. So it really gives you a sense of where organizations are doing quite well or need to improve, from a culture standpoint and that commitment to excellence. And when we take a look at all the open-ended comments respondents had with respect to these principles, we saw certain strengths being mentioned. And this is wonderful to see that that the respondents are feeling good about their organizations with regards to these things like teamwork and their vision and that dedication to quality management and accreditation and their partnerships, the way things are governed and the way leadership and employees are developed, and that focus on the patient and data-driven improvement. So this is all very good. And one thing I might mention about accreditation is I looked at the accreditation system for the healthcare sector in Canada years ago, and I was looking at it with that view through the excellence lens and taking a look at their criteria. And yes, of course, they cover all the clinical criteria, but when you take a look at the key management areas in an excellence model, they were covering the governance and leadership key management areas, but the other 7 were covered very well. So I thought, whoa, there's a real opportunity for improvement there from the accreditation system. Now, on the opportunities for improvement side of things, as we looked at the open-ended comments, these are the sorts of things that were coming through, that there was a real need to improve communication, transparency, things that they could do to retain their employees and better develop them, strategic planning and leadership involvement, things like technological advancement and using technology in what they're doing, infrastructure, customer focus, and in the cases of those that are businesses, business development. And just taking a look a little bit more closely at some of the comments that we got from respondents around the world, it tells a bit of a story too. And here's a comment from Brazil. You can see that this is quite a sophisticated organization that's been using quality management. It started in a couple of areas in their hospital, but then expanded it to all other services 10 years later. And here's a comment from the Caribbean about their teamwork and trust and vision, and how they need to pick up in continuous education for everyone, and work a little bit more on communication. And when I must say, when we do an assessment of this nature with an organization and we get a good cross section of employees to participate, it's quite enlightening when you see the ratings and the differences between roles and the comments that people have, and what the organization looks like through each of their lenses. It's probably the best description of an organization you can have on which to build on those strengths and address opportunities for improvement. So here's a comment from Tanzania in terms of the good work that's going on, and then of course on the flip side, the need for more funds to do what they do. Now the key management areas, there's 9 key management areas, and these are the listed here. They're basic functions that we see in most organizations. I think in the continuous improvement area, that's where we look at all these key management areas and look at how we're doing and where we need to focus effort. On the performance measurement side of things, we've got 2 types of performance measures, and we've got the measures that we use in each of these key management areas, but we've also got performance measures that we use for the organization as a whole. And so when we look at healthcare organizations in terms of how they're doing on these key management areas, just from kind of a high level, we see the use of this scale. It's a much more objective scale, looking at the way things are approached and deployed, and the results that are being experienced. And we've got 4 points. Are we just beginning, off to a good start, doing well, or high performance? And in the anything over 6 consistently across these key management areas, these would be award recipients in most nations around the world that have national excellence programs. But certainly those in the high performance area would be the real best in class organizations. But here's how the healthcare organizations said that they were doing overall in these key management areas. And like I said, there's 102 practices across all of these areas, and half that for a micro-sized organization. But you can see where the ratings have dropped considerably compared to the principles, and how organizations are in that kind of doing well category, kind of at the bottom of it, and in some cases they're more so in the good start category when it comes to planning or their work with suppliers and partners. But we see a strength here, more of a strength in the performance measurement that's used for the organization as a whole. So here's one comment that we got from an organization in Pakistan. Looks like they're quite sophisticated. The fact they have a quality team, and recognize the need to focus more on customer needs and expectations, especially the process that they use and the economy. So when you think about it, why do you think there's such a difference in the ratings between the principles and the key management areas? I know we're using a subjective scale for the principles and we're using a more objective scale for the key management areas, but what do you think is happening there? It's about a 1 point difference, and we see this consistently around the world, not just in the healthcare sector. So what are your thoughts about that? You can respond in the chat or simply put up your hand if you want to make a comment verbally.
One input so far, that key management areas are in greater depth than are the principles. So a little more intense look at what they are and give you a lower rating.
Yes, and that's absolutely right. And it's very interesting when you look at the direct relationships between these two things. I don't think a lot of people realize that all these practices and all these key management areas have a direct relationship to the principles as well. You can take a look at those direct relationships and you can say what's influencing what. And if you've got a low rating in one of the principles, you can take a look at all the directly related practices as a way to improve that rating. And then of course there's direct relationships within the practices themselves in the key management areas, you know, the relationship, for example, that there is between strategic planning and business planning and so forth. So it's all interrelated and interconnected. And when you take a look at how you're doing in all these practices on the key management areas, it certainly is a much deeper dive that forces you to examine your organization in quite a bit more detail in terms of what you're doing and what you're not. And we get those kind of comments back too in the open-ended comments that, oh my goodness, this gives me a different view of our organization now, and lots of food for thought.
Okay.
So in looking at the ratings that we have across these areas, and you can see on the left-hand side the practices for, in this example, the governance area. We can see that in the governance area that the highest rated is the ensuring that the governance system meets their obligations. And these are ethical, legal, financial reporting obligations. It's good to see that one rated the highest. But there's some things like, identifying your governance responsibility to stakeholders as being a little bit lower rated, or something that organizations need to work at. Here's a comment from someone in the United States and talking about their governance and how it's all internal. And it's perhaps these are opportunities for improvement, you know, that the governance is internal and only involves certain roles within the organization, and the board minutes aren't published. So it's not what we like to see in an excellence model. We want things to be a little bit more open than that. So indeed, you know, here's some opportunities for improvement. On the leadership side of things, we can see that organizations are developing their corporate statements and communicating them to their stakeholders. They're developing strategic plans, and they're really doing a lot of the leadership, undertaking these leadership practices, ensuring that senior management is involved in setting direction and communicating that to others, and promoting teamwork and communicating openly about how the organization is performing to the employees, and they're demonstrating responsibility to society and the environment as well. So some really good things happening, but there's these opportunities to improve using risk management to assess their strategic goals and their objectives, and also finding a way to better link senior management rewards and recognition to organizational performance. And lastly, to remove barriers that are getting in the way to organizational effectiveness. And here's a comment from Canada, from an organization. They're kind of getting in, this organization is kind of getting more involved with an excellence model now. And they say they're late to the table, but I say, hey, better late than never, right? And they're identifying, you know, what's going well and what's not. And these kind of open-ended comments really tell the story about, you know, things that they need to work on and things that need to improve. So it's all good at the end of the day. Organizations find out so much about themselves by doing this that lots of times leadership had no idea that these perceptions were there, or these things were happening. So it just gives them an opportunity to strengthen the organization. In the planning area, this was an area a little bit lower rated for the healthcare sector. And so we see most of the ratings are kind of in that, you know, good start area. And the things that are jumping out as really needing improvement are developing contingency plans for unforeseen circumstances and conducting a capability gap analysis for resources. And these are indeed, we see this worldwide as well across other sectors. So in the planning area, I guess there's more work that can be done to, create these business plans based on factual information and reallocate resources when you need to, and to always be monitoring and reviewing your plan and making changes to the business plan as needed, or you might call it an operational plan. So there's some opportunities for improvement there in the planning area. And here's a comment from Nonprofit Association in Canada on the upside. They're saying, boy, we've got a really great CFO that's doing some good work. But again, they've noted that this particular professional could communicate a little bit better with the employees. On the customer side of things, and so this is the way we're dealing with the patient, and doing some good work on aligning employees on the importance of the patient, and training and empowering employees to be advocates for the patient, and responding successfully to feedback from the patient. So really some good high points there. But a little bit more work could be done in using research to better define and segment the patient so you can better understand your particular markets. Ensure positive experience for the patient as you look through all the moments of truth that a patient has when they come into contact with the healthcare organization, and making it easy for them to provide feedback across the many channels we have these days. And lastly, to reaffirm presence in the marketplace, and that's really taking a look at how relevant the services you provide are to the marketplace, and are you in step or out of step? And here's a comment from a large size organization in Saudi Arabia that looks like it's very sophisticated, and in terms of the way it's administering their affairs and using technology and matching talent to what the patients need, and even going as far as recruiting people that speak patient languages, which is lovely and must give patients a lot of confidence. On the employees key management area, here's another area where organizations are doing quite well on most of these practices in this area, but there's an opportunity to get people more involved with improvement initiatives, encourage employees to be more innovative, and removing barriers that are getting in the way of employee effectiveness. But the highest rated is the encouraging employees to share suggestions and ideas, which is fantastic, because that's where a lot of our improvement comes from, isn't it? And here's a comment from the United States, from someone in a management role. And they say, here's some opportunities we have to do what we're doing in this employees area a little bit better. So they recognize that all these things are important to functioning well. On the work processes side of things, a lot of the practices here, they're in that doing well category, designing and documenting their key processes, making sure their service and system standards are met, taking corrective action when problems occur, preventing the recurrence of problems, and communicating changes in work processes. Those are all going quite well. But interesting that is some of the lower rated items are ensuring processes are in place to anticipate change, analyzing processes on a regular basis, involving stakeholders in analyzing work processes, and using external data or benchmarking to compare how your organization is doing to others. And here's some comments from Canada, how their QA department's doing a pretty good job and reviewing things when things go wrong, but there's a need for this comparison data. So they'd like to see more, how do we compare to others and how can we learn from others? And interesting that there's no limited or no involvement of the service recipient in the review processes. This is pretty important. So yeah, that's a great opportunity for improvement. They'll learn a lot from that. On the suppliers and partners end of things, doing quite well in selecting suppliers and partners on the basis of criteria and developing win-win arrangements with them. But there's opportunities here to be more closely involved with them, sharing information, let's say about business plans, getting them involved in the development of new products and services, or how to go beyond social and environmental standards. And from the United States, this is an organization that really understands that it's so very important to spend the constituents' tax dollars well and take advantage of partnerships that can be created that not only contribute to better functioning organization, but also the way those tax dollars are spent. They're all part of that supply chain. It's very much a part of what we all do. On the resource management end of things, and this is where we're taking a look at our buildings, equipment, the assets that we have, financial resources, technology that we use, transportation that we use, and so forth. And organizations are doing quite well in this respect. A high point is identifying the technology that can be used to make work processes more efficient or effective, and also preparing for resource interruptions and managing the security of resources, minimizing the adverse impact of resources on society or the environment. So organizations are doing quite well in those respects. Probably just the lower rated one is that providing access for stakeholders to knowledge and information. So just opening up communication, lines of communication there with stakeholders is an opportunity. And here's a comment from Canada about their strong finance and IT team. But again, the financial resources end of things is a challenge given cuts. And they say, gee, just by communicating about it, that gives everybody a better understanding about the limitations, challenges, and frustrations. But it's an opportunity to put your heads together too to see how those cuts can be better addressed. In reflecting on continuous improvement, organizations are taking a look across these key management areas and focusing on opportunities to do better. I mean, most of the key management areas are performing quite well, particularly leadership and work processes and resource management. And when they take a look at the way they're measuring performance across the key management areas, there's some strength in the leadership measures, the planning measures, the employee measures, and resource management measures, but an opportunity to do a bit better on the governance measures and the supplier and partner measures, and even some of the work process measures. If we take a look at the way they measure for the organization as a whole, there's the ones standing out, the quality of products or services, the customer satisfaction are high, and financial performance. And these are the measures we like to see in micro-size organizations, but we also like to see employee satisfaction. And you always want organizations, larger size organizations, to use a handful of these measures. So we've got a nice balanced system of measurement. So this gives us a little bit of feedback that yes, that indeed is happening, that organizations are using a balanced system of measurement, which is good. And a comment from Canada about how they're starting to focus on client confidence and client feedback and employee wellness, interest in seeing how they compare to others, and then they recognizing the need to do a better job in certain areas. And from Pakistan, um, recognizing they've got a lot of long-term employees and they need to do more to support and retain them. Proud of the way that they're on the way to excellence. And with that, and considering, what we've been talking about the global OE index and how organizations are doing, how they're doing against the excellence model. Now I'm going to turn it over to Dale so he can tell us a little bit more about a very high performing organization, which is the Mayo Clinic. And we've got lots of examples of national award recipients around the world in the healthcare area. But when you take a look at healthcare organizations on a national basis, those that stand out as being high performing are a very small percentage of the population compared to others. So it's really important to listen to these kind of stories about best in class organizations. So looking forward to what you have to share with us, Dale, about the Mayo Clinic. I'll turn it over to you.
Okay, thank you, Dawn. Yes, what I'm going to talk about is one, if not a few more examples of what I call success stories in the whole arena of using the principles, the best practices that Dawn talked about in the healthcare setting, whether it's a hospital, whether it's a healthcare system, which includes more than one hospital. In the case of Mayo Clinic, for those that are on the line that don't know about the Mayo Clinic, it's been around for over 100 years, formed by two Mayo brothers and their family here in the state of Minnesota in the United States, where I sit. Their main Mayo Clinic campus is probably about 90 miles from where I'm sitting today. The Mayo Clinic today has close to 80,000 employees. That's 80,000. 80,000 employees, has 3 or 4 major clinic locations here in the United States. In Minnesota, there's one in Florida, there's one in Phoenix, Arizona. But the Mayo Clinic represents a real focus, an attempt. Do they have all the answers? No, but a real focus on patient-driven healthcare. What does that mean in terms of the Mayo Clinic? It means you as a patient, you don't see one doctor that treats your cardiac issues, another doctor who may treat your orthopedic issues, another doctor that may treat your other issues on the area of your healthcare. What the Mayo Clinic does, they call it integrated healthcare, which means you go down there. I have had friends that have gone down for an annual checkup, and you get 5 doctors that show up all at once. 5 doctors that show up and they compare. It's not a referral. It's not seeing your cardiac doctor one day and another day getting referred to somebody else. And the 2 doctors maybe know you by name, but they don't compare results. What the Mayo Clinic does is integrated patient care, and they have been doing it for over 100 years. And their focus in terms of framework, they have selected operations that have gone through. This can go back. I can share with you as you like offline some of their material. But what they have done, they have, as this excellence framework material came into existence, I have been fortunate to live here in the state of Minnesota, where we had some of the first applicants to these national and state awards back in the 1980s. The Mayo Clinic has been a pioneer in that. Not the entire clinic, but selected hospitals that applied for it. And the Mayo Clinic in rating comes out as in the top 10%, or not, if not one of the top hospitals in the world. They get over 1 million patients per year with, as I said, 80,000 employees. And they have, extraordinary results. They have issues of continuous improvement in terms of employees. So if we showed you an assessment by the Mayo Clinic, they would be doing very well in probably 60, 70% of some of the principles and some of the best practices, but they've got growth and development areas. So the question comes up, if you want to use the Mayo Clinic as a benchmarking, a global example, question is, why do not a lot of other hospitals do this? Well, it's like asking the same question in the business arena. I used to work in the public sector in Florida. What is in Florida? There's a Mayo Clinic there, but there's also something called Disney World. Disney is known for excellence in service. A lot of their material, just like the Mayo Clinic, is publicly available, meaning they don't hide. There has been, in the last 3 to 5 years, there's been a major 1-hour documentary on the Mayo Clinic, what they do, why they do it, and everything. So the question from a benchmarking is, why is there not more hospitals that at least go in that direction? Well, benchmarking is not an example where you can just simply, in the case of healthcare, go down, visit the Mayo Clinic, come back, plug it in and say, here's my hospital X, hospital Y, and we're going to do what the Mayo Clinic does. No, you got to know their history. You got to know why. You got to know their leadership, all of that aspect. So the Mayo Clinic has got an extraordinary record here in the state of Minnesota. When you talk to people that do, as we asked at the beginning, an annual checkup, you go to the Mayo Clinic and you compare your annual checkup from, I won't name any other hospitals here, but hospital A, B, C as a comparative base. It's distinctly different. As I said, you go and normally where I go, a hospital where I go here in Minnesota, it's seeing one daily physician that's assigned to you. You go to the Mayo Clinic, you get, as I said, 5 clinics. So their focus is on really the customer, the patient. Patient care comes first. Their results in terms of innovation, coming up with solutions, investing with 80,000 employees, and they have billions of dollars available. If you look at their financial results, you look at their patient satisfaction results for those that have gone there, they rank in the highest percentile of any other hospital here in the state of Minnesota, and I would say probably across the world. They have begun to look at expansion with partnerships with other hospitals, other countries, one in Abu Dhabi and the United Arab Emirates that they're putting together in the last few years. They have integrated healthcare records by individual. Again, when you come in, they have all of your records available there, history. So you don't have to come in and explain to your doc. They've looked at everything. And so the Mayo Clinic, to me, yes, we've got selected examples of hospitals that are operated by the Mayo Clinic that have prepared here in the state of Minnesota. There's 2 or 3 examples over the last few years where hospitals that are operated by the Mayo Clinic have actually applied to our state award and applied toward the national U.S. Baldrige Award, and extraordinary results. But their focus overall is integrated medicine with the patient at the top of the focus. So when you talk to patients that have been there, I have a friend, colleague who used to work at a company here in Minnesota. It's called Medtronic, which does pacemakers. His wife had a transplant, heart, lung, and kidney transplant, all at once at the Mayo Clinic. This is about 2.5 years ago. She is now out walking, biking, all kinds of exercise, has recovered extraordinarily. That is the Mayo Clinic. And they had assigned, in that case, they assigned multiple experts in terms of that kind of transplant. That's what the Mayo Clinic does. Also, the Mayo Clinic against major other clinics and hospitals across the world. I could take the top 3, 4, 5 here in the United States. There's something called the Cleveland Clinic. There's Johns Hopkins Hospital, which is in the East Coast. And Mayo's results in terms of patient satisfaction are way above many of these others. Why do they do it? How do they do it? It's all a matter of historical, cultural leadership. when you see the presentations done by their president, CEO, they have a focus on. They do things distinctly different. They don't, for example, pay their doctors that work for the Mayo Clinic on the basis of any kind of tests. There's no performance based compensation. It's based upon salary, so that you work. It's a nonprofit organization in terms of their structure, and they want people that work there that are not necessarily in it because they went to medical school and you want to earn a lot of money. That's there. But the people that come is the values they bring and their commitment to the patient as far as their interview process and everything else. Do your personal values as a medical professional link with the values of the Mayo Clinic? That's what it's all about. And it's been around for over 100 years. So in terms of benchmarking and trying to answer the question, you can't necessarily go, as I say, in the benchmarking world, and I've done a substantial amount of benchmarking on a global basis. You can't just come in and say, gee, I want to replicate what the Mayo does. It's a cultural thing. And so you come in and you want to look at what is it that they do? Why do they do it? How do they do it? And what is it that I can do in my organization? But this is one distinct organization that works on the basis of integrated patient focus. They have issues. I could cite in some of it, employee satisfaction is not as high as it could be and so forth. So if you were to take, as Dawn has suggested, and I could give you some examples of all of the metrics that they focus in on, or if you focus in on these awards that I have for many years, you look at the strengths and areas of improvement. The Mayo Clinic has an extraordinary story, but they still have areas for improvement. They're into the arena of managing our healthcare system, which is outside the Mayo Clinic, managing the financial aspects of it. Where does their funding come from? And can everybody have access to the Mayo Clinic? Historically, that's not been the case. That if you have insurance and you're covered, well, maybe you can get access. So they're working continually on improving access to the Mayo Clinic and trying to get other hospital organizations to focus on what comes first, the patient, or is it finances? Is it make a profit? And if the patient satisfaction suffers for that, because here in the United States, many of you may have seen that we spend more on a per capita basis for healthcare than any other major developing country in the world. So what does that mean? That means that our outcomes as a healthcare system, not Mayo only, but as a healthcare system, are less than other developed countries, whether that be countries like Japan. Their life cycle, their average age is much better than what it is in the United States. So Mayo is now involved with broadening their approach to excellence to these broader systemic areas. So that's what I'll mention regarding benchmarking. There are, beyond the Mayo, if you were to take, as I have had the opportunity to do, look here in the state of Minnesota where I sit, or in the Baldrige program across the United States, there's data to show that there has been, as Dawn had mentioned, there's been probably 25 to 30 hospital organizations over the last 20 or more years involved with the Baldrige program that have either won the National Baldrige Award or are cited as role models. That's in the United States. If you were to take, as Dawn had mentioned, there are other excellence organizations like our Baldrige in New Zealand, in Australia, in Canada. If you were to isolate, and I've begun to do that, just hospital or healthcare institutions, it's probably into the hundreds. But if you take that across on a global basis as a percentage of all of the hospital healthcare institutions, there's a lot of area for continual improvement and getting more organizations. So the purpose in talking about the Mayo Clinic, it just give you an idea. Here's one organization over a 100-year period, and in the last 20 to 30 years that I've been linked in, because I've been mostly here in the state of Minnesota, the Mayo Clinic is there. But why do not more? You've got to focus in on what your strengths, your weaknesses are, and how you can potentially replicate not 100% what the Mayo Clinic does, but perhaps a large percentage of that. So learn by global benchmark. So that's all I'll mention on benchmarking. And when we get offline after we complete the recording, we can talk about your individual situation, how Mayo benchmarking may or may not apply, and go from there. So that's it for that, and we'll turn it back to Dawn.
Okay, thanks, Dale. I really love hearing about that integrated healthcare approach. It's they've really addressed an area to me that is a real issue in the healthcare system, especially I notice with as a population ages and elderly people have all sorts of different practitioners weighing in on the issues that they're facing, and they're all kind of working independently and prescribing different things, and those prescriptions then end up interacting with each other, and it's like a snowball effect with other issues that crop up, and it doesn't end well. And this whole integrated healthcare approach is really an important learning point for others, I think. Not to mention there's an awful lot else that we can learn from the Mayo Clinic, and just looking at healthcare organizations that have been recognized by their healthcare national healthcare programs. There's lots of great examples, and it's always really exciting to learn about what they've been doing, the improvements that they've made, and the results that they've realized. And so it really gives you a good feel for the return on investment that's available with an excellence model. So just to the audience, one more question. What do you think we can do to elevate the performance of healthcare? Have you got some additional ideas that you want to put into the chat or introduce putting your hand up and speaking verbally? It's probably a pretty loaded question. So any ideas coming through? Dale, you're looking at the chat.
Hi, Dawn. Can I come in?
Yes, go ahead.
Dr. Shweta here from India, and it's a wonderful question, and and thanks for sharing. I I got the invite and attended this, and a wonderful survey which has been done, and just to get back to the question, which is what's how we can elevate, is that what we are talking right now is the patient centricity, and with Dale presenting the best practices from Mayo Clinic, and I can reflect upon, it's very important that we move towards patient-centered care and customizing the care around the patient, because every patient is a separate individual. Their needs are different. Their perceptions to quality is different. So we really need to, the hospitals or the healthcare, everyone in the healthcare working, they all need to focus on that, how do we you know uh, organize or coordinate around the patient, the care which is being provided right from his patient coming and seeking the healthcare, right from the admission entry point to the exit. And also, this does not end here. We need to ensure what is a main area of improvement is the communication. We don't effectively communicate to the patient that this is, because then only we can partner the patient in the care, and that serves, if they partner in the care, their own care, our healthcare delivery is more safer and more effective, and it's a win-win situation. So I would just like to introduce, in the interest of time and everyone can come in, is about creating that patient-centered care, having a advisory councils or patient focus groups so that they can partner and they can advise the healthcare what is that basically inviting the patients on the table, like, and discussing it, that what is what we need to improve upon. That is the concept which is now growing up. And even WHO last year in the World Patient Safety Day, they said that they had this worldwide that you need to involve the patient in the care. So that is what we need to go forward with this thought. Thank you.
Those are such important points. And don't we see that in the data too? That the need to do that better, right? The patient being the center of focus, really understanding who the patient is and their requirements, and then customizing what we do for the patient, like you say, and involving them more in the care because we're partners together,
Absolutely.
healthcare profession and
Absolutely.
the patient together, in making sure that patient thrives, right?
Yep.
Yeah,
Yeah,
absolutely.
Yep.
fantastic. And I couldn't agree with you more. And I think that there's been some good insights here in your comments and also the benchmarking example and that we've heard that here's some tremendous opportunities. And I think that the data and the open-ended comments of our study shed some light too on ways in which we can strengthen the healthcare sector. And so, with that, and before we open it up to more all around discussion, I just wanted to share with you what we consider as a good way forward for a lot of organizations is once they've conducted their scan of the environment, looking at how they're doing on the social progress index or the OECD data and maybe the global index that we've got, that they complete a self-assessment. And in doing so, really encourage organizations to involve their employees in the self-assessment because you get these different perceptions uh, from staff, management, leadership. And you want to make sure that you include that so you've got the benefit, all of those aggregate ratings and open-ended comments to really identify what's going well and what needs to improve. And then just to build on those strengths and address the opportunities for improvement. And another thing we really believe in doing is looking to all the employees in terms of the improvement initiatives and getting them involved in action plans, whether they're working individually or on teams, and working on those action plans, sharing their progress with others, looking outside of the organization and learning from others as well. So with that, this is some ways that we've found over the years. I know I've been working in this area for about 40 years. I found that this works really, really well. And this way you really get everybody in an organization involved in your excellence or your improvement journey. And all that wonderful knowledge stays within the organization. And this is a good way to move forward in terms of harnessing the talent within. Because boy, those people in the organization have got such good feedback about what's going on in the organization, and they shed an awful lot of light on what's going well and what needs to improve. So with that, I'll just say thank you, and I'll stop sharing my screen, and we can open it up to a more open-ended. We can stop the recording and then just open it up to a free-flowing conversation.